Half of the children under the age of 5 are stunted in Pakistan. The real statistics is 43.7%, which is a lot. Only 38% mothers breastfeed their children. And to rectify all of these, we have to come up with preventions and awareness. So how can we prevent stunting? Why is breastfeeding so important? What are the problems that can be caused if you do not breastfeed your child? What are the international and the national organizations doing about this? To answer all of this, today we have with us Dr. Basir Achakzai, who is the Director Programs at Ministry of National Health Services, Regulations and Coordination, and Ms. Melanie Galvin, who's the Nutrition Chief at UNICEF. Thank you so much for your time. So first, let's start with telling people what breastfeeding basically is, because we see in Pakistan that mothers are breastfeeding their child. But what is the problem? What is not equivalent, to your perception? I would like you to enlighten. Yeah, please.
Sure. Breastfeeding in Pakistan is a practice. It's a good practice. It affects the very survival of a child in some cases, but also their growth and development. Right? It's very critical. Breastfeeding is not practiced very well in terms of what we would consider. I'm going to have to repeat this because breastfeeding for us is practiced in Pakistan, but not well enough. All right, so we do have some people that definitely breastfeed. There's a lot of reasons why mothers don't breastfeed, but it is the most critical activity in terms of healthy growth and development for a child. It also actually affects the survival of children. For us, we focus sometimes on poorer families. Many of them do not breastfeed for a variety of reasons. The children get sick, the children are weak, we have high infant mortality rate because of it. It's actually really an incredibly critical health intervention overall.
So we see women in Pakistan, they're breastfeeding. So what is so unfortunate about those cases? Because we don't see the problem. We don't actually understand why breastfeeding is so important. Could you shed light on that?
Yeah.
The breastfeeding rates are going backwards. They're not good. They're in fact the opposite of good, I would say. In some cases, Pakistan has the lowest rates in the world. So while you do see it, and I agree, you see it, we don't see it at the rates, the levels. We should be seeing it, right? I mean, it's changing. There's no question. It's changing. But slowly, and it's just beginning now.
Yeah.
So I would like to ask you, Dr. Saab, what is the health ministry doing to increase the awareness across mothers and young mothers basically?
Yeah, since the federal ministry here in Islamabad, we have certain rules which have been assigned as per law, as per constitution, and that rule is to provide policy guidelines to the provinces, and also to provide an opportunity to all the nutrition partners to work together with synergies, and also to seek their support, the support of the nutrition partners, UNICEF, WHO, World Food Program, all the nutrition partners, UN agencies and other INGOs, that where our gaps are and how to fill those gaps. So this is the prime responsibility of the federal ministry. And secondly, our main responsibility is to look into the international commitments. We have certain commitments for which we are the signatories. So it comes under our domain to seek the information from all the provinces, and those information must be shared on a periodic basis with the international organizations, with international agencies. So this is the prime role of the Ministry of National Health Services.
So this is their role, but do you think that they're doing enough for this cause, or is it enough?
If I highlight few of the areas on which we are working together with all the nutrition partners, especially UNICEF, in context of the breastfeeding, because it is a very, very important area in addressing the malnutrition or the strengthening of the children below 5 years in Pakistan. We have certain laws, we have developed some policy guidelines, we have developed some strategic document with the support of UNICEF and other UN agencies. And those strategic documents are very important, which are technically sound, keeping in view the international recommendations, keeping in view the WHO recommendations, and keeping in view the desire and the commitment which we have made World Health Assembly, for example, or with other international forums. So those laws and those regulations which we have made are actually be implemented at provincial level.
Okay, so it's good to know that the government is actually doing something. So Ms. Melanie, I would want you to know, tell us that what are the standard recommendations for breastfeeding?
Well, there's a handful of things that are important about breastfeeding, and I think they're very simple, and we just have to keep repeating them so that we change kind of the awareness level of what needs to be done. Breastfeeding needs to start within the first hour of life. That's critical actually for survival. That's the one that we worry about child survival for, because immunity is passed on to the child through the mother's breast milk, and there's a period of time where that's quite important. So breastfeeding a child right away. We want 6 months of what we call exclusive breastfeeding. So this is a practice we do not see well done in Pakistan. Ideally, a child gets nothing but breast milk. That also means they don't get water. That also means they don't get tea, which, by the way, they do get periodically. And we need to get that message out that the baby doesn't need anything more, that's perfectly fine. At 6 months, the baby starts to be fed other foods, non-breast milk, but we would like to see children breastfed for 2 years. So that they could even longer, actually, but certainly from 6 months to 2 years, continued breastfeeding is important. What have I got? That's
no, that is good. Actually, the message, for example, which should reach to each and every person of the society, of the community, that primarily this is the first right of a child on a mother, that he or she should, the baby should get the breastfeeding, and exclusively breastfeeding is more important, because it is a sort of bound in between the child and the mother, and it is not important only for a child. It is at the same time important for mother as well. There are so many diseases, so many conditions which are attached to not breastfeed their children. So those diseases, a mother could be saved from breast cancer if she breastfeeds the child. A mother would be having more love and affection with the child if she breastfeeds the child.
What is the percentage, if a woman does not breastfeed, what is the percentage like of her getting breast cancer?
Usually, if you say today the statistic in the world, so it most importantly, the not breastfeeding is a factor which leads to the breast cancer. So it is on high. It is on high as compared to the normal cancer of breastfeeding. So this is why we are sending a message along with our nutrition partner to our societies, to our families, to our individuals, that breastfeeding is so important, not only for a child, but for mother as well.
There are a lot of myths about colostrum in Pakistan. Yeah. So I would want you to tell us more about the importance of colostrum and what it contains.
This is very important question in the sense that there are of course so many stories attached to this, but I can say it in just in one sentence that colostrum for a child is that much important. This is the greatest gift from a parent to a child, if I am say, is the greatest gift, number one. Number two, all the myths or the misperception which are attached to this, that this colostrum is poison or it is not good for a child or it should be discarded. It is just a baseless things. The most important is, as a so technical person from UNICEF and as a doctor, I must send this message to the families that colostrum is the topmost. I can say that this is a very high quality vaccine for a child.
Yeah, that's what I call it medicine. It's a way of delivering medicine, a very effective way.
Okay, so if we talk about women and working women and housewife, who do you think are more hesitating in breastfeeding their child?
Well, you know, this is interesting because I found it a very fascinating kind of set of statistics, but we do know that poorer families breastfeed at higher rates. And more surprising, those who've had more contact with the formal health system are less likely to breastfeed. So we think people receive advice against breastfeeding and use of formulas, for example, at a much higher rate in wealthier families. So we have a lot of information on kind of why people are not. And in many cases, though, I think what we've seen is that there is breastfeeding, but it's not necessarily breast milk, right? And that creates a whole other subset of problems for us around awareness raising, for example, that we need to tackle really very strongly here.
It's ironic that the educated class in Pakistan, they are more hesitant to breastfeed than the poor class.
There is some misperception in our families, even in educated class, as you said, that it is going to be figured out, or the ladies who are unable to, due to their work, they are unable to feed frequently their child. So these all things are very negative for the health of the child and for the health of the mother. Breastfeeding this is a state responsibility. This is the responsibility of the state to bring such laws that a mother should feed her child in a very free atmosphere and a very, you can say, in isolation, wherever she required, either if she is at workplace or even if she is traveling. So we should provide then the mother an opportunity that she must feed her child with dignity, with all the desired protocol what she wants. So that is basically the prime responsibility. And in continuation of the importance of this environment, we, along with UNICEF, last month we established a breastfeeding corner at National Assembly, and that was why we did that. We know that there is not a lot of women over there, but that is a symbol of ownership by the government. This is a symbol of the importance in the eyes of the government, that each and every organization, either banks or the institutions, INGOs, NGOs, various departments, they should at least establish a corner for their female staff to breastfeed their children.
Yeah, that's something that we're lacking in Pakistan. Exactly. They don't have this.
There has been a lot of work to try to establish environments, I think. We're really seeing an acceleration of the work under the leadership of the government over the past couple of years, where tackling problems in the workplace to make it easier for women to breastfeed are moving forward. It's not ideal yet, but I believe the direction has been really very positive.
But that's not being practiced a lot. That's true, yeah. Yeah, it's going to take time to get it done. So yeah, can you specifically tell us what are the benefits and the the adversities if you do not breastfeed?
Topmost benefit is that the mother milk is free of cost, number one. Free of cost, and there is no economical burden on that family or that woman that she is feeding her child, number one. Number two, there are so many health issues with women. By breastfeeding, she can prevent that, number two, because she will be spending a lot of her money on treating her. Number three, the benefit for child, as I told you earlier, that the breastfeeding ratio in Pakistan is very low, very discouraging. Until unless we do not achieve above 70% breastfeeding, especially the exclusive breastfeeding, we cannot count our country in the line of the developed countries. Number two, the country economy depends on if you breastfeed a child, this child will be healthy, this child growth will be okay, this child will be IQ level be great, he will be able to become a scientist, he will become able to become an engineer, a doctor, or a pilot. Otherwise, if a child is not breastfed, there are so many health related issues attached to not being breastfed. And to the economy of the country, let me share with you that it is much more worse than the current situation of the, for example, if we have a crisis of electricity or the power shortage in Pakistan, and we are spending more than 3% GDP on that. So the malnutrition, or you just counted that if 44% of your children is stunted, so after 10 or 15 years, same children will be your working class. So they will not be able to perform as a normal child. So your working class is going to be affected by only this small initiative, which is called the breastfeeding.
So what about the awareness that we were having a lot of awareness programs being done by the government and UNICEF across Pakistan. What do you think it's bringing any change yet?
Well, I mean, I think absolutely. We've taken a look at different groups that we want to focus on. For example, doctors, practicing doctors, very interested in what they're saying, what they're recommending. We need to teach them the newest science, but we also need to have them make sure they understand the laws that exist, and those two things can help us change behaviors in that group. Then we can take a look at mothers, but not just mothers, because they're very influenced in their activities from friends, from their mother-in-laws, from their own mothers. So let's say a broader group of women. How do we change their awareness? The government's been working on programs nationally and provincially with support of UNICEF and others, where we're more generally trying to raise awareness through, let's say, advertising campaigns. That's a model you can use for a broad swath of the population.
Just to add into it, that look, Pakistan is a 200 million plus country, a huge country. Our poor indicator will be affecting all the region, and we are certainly currently we are affecting the region health whatsoever, if it is nutrition, if it is TB, malaria, or HIV/AIDS, because keeping in view the population of Pakistan. We in Pakistan, fortunately, we have one new tier, not very new, but the tier of a healthcare provider, which is called lady health worker. So those lady health workers, which are around 120,000 in Pakistan, with the support of UNICEF and other nutrition partner, we have trained those lady health workers in each and every aspect of related to the breastfeeding. They are a sort of counselors. They are going to house, and they are counseling with the new mothers, and they are telling them the benefit of the breastfeeding. Along with all these interventions, our healthcare providers, which in my personal opinion is not doing their job 100%. So we are trying to make such a policies for their trainings. We are making such a policies along with our development partner. For example, UNICEF is working in all the provinces, all the regions. They have their established offices. So we have a very close coordination with all these UN partners or UNICEF. So they are time to time in service training they are doing. We are providing training to the gynecologists, to the doctors, to the GPs, lady health workers, LHVs, and even the mid-level managers, the district health officers, and to tell them that how nutrition is important, and side by side nutrition, how breastfeeding is important.
Dr. Basir, I myself have seen a lot of mothers using formula milk. So, you being a representative of the ministry, I would want to take your view on this.
May I start by saying this, that formula milk is in no shape, in no quality is in comparison of the mother milk.
Okay.
The mother milk is a complete food for a child. Even during this exclusive breastfeeding phase, which is 6 months, this child do not require a single drop of water, no honey, no gutti, no makan, nothing. The mother milk contains all the nutrients which a child requires: water, protein, vitamins, all minerals, each and everything. So my personal view would be that in the child health, from its born till the age of 5 years, these 2 years of breastfeeding plus the exclusive breastfeeding for 6 months plus the colostrum, this is the foundation of a good health of a child.
So we've seen some laws regarding this, but we don't see them being practiced. Why is government not doing something to stop this? Because, we can see the availability in the market, and then obviously people go for options. So why?
There are certain things which there are certain responsibilities which are divided into the provinces and in the federal level. At federal level, in 2009, the National Assembly of Pakistan, they have passed a bill, the breastfeeding bill, the child protection bill, child health protection bill, and then in accordance to that national the bill which has been passed by the National Assembly, we, along with all nutrition partners at federal level, we have a National Infant Feeding Board, which is represented by all the provincial secretaries, all the partners, including the baby food manufacturers. This board is basically for looking after all the laws on all the rules and regulation which are mentioned in this bill. Now, the actions or the implementation is at provincial level. So we are urging our provinces, we are requesting our healthcare authorities to implement these laws, because we have chalked out each and everything in that bill, that if wrongly anybody prescribe formula milk or a breast milk substitute, so he is liable for that much fine and that much imprisonment and all these things. So now we were working with the provinces a little bit more closely, although they have their committees to look after these area, but still involvement of district health authorities with the district administration is mandatory for this, to implement such laws. And at the same time, I must say to our healthcare provider, especially the pediatrician, that please do not advise the breast milk substitute unnecessarily.
Right. So, we see that women are being educated at the urban section of the, our country. Like, is there anything that both the, like the ministry and the UNICEF, they're doing for the rural areas? Are you trying to aware the women of their rights and, the laws and what they say about it?
Let me share this one good news, that the breastfeeding ratio in rural area is better than the urban areas. This is one thing. But again, it is a very good saying that, for example, the rural area, when anything cosmetically beautiful, bright, if it goes to the rural areas, so the people usually accept it. So this is our responsibility through lady health workers, through healthcare providers, to tell the family, to tell the population that these formula milks, they are by no means the substitute of the breast milk. And at the same time, the media can play a very pivotal role. The electronic and print media, the radio, and everybody. For example, I was just the other day discussing this with a religious leader, that you people have a very great role, because whatsoever we are talking, it is not from Melanie's tummy, it is not from my tummy, it is written in Quran. And Quran is a book for us as a principle of living. So if we follow even the Quranic thoughts, so that is very important, and a day will come that all breastfeeding rates will cross 70%.
I'd like to add to that too. I think it is important to note that in every province now there are nutrition programs that are helping get messages out to the very ruralmost areas. And I think we've seen that in the last couple years, and they will continue, and there's more interest. So there really has been a great deal of work. We're in a completely different place now in 2017 than we were in 2015, and exponential kind of change. It's hard to change awareness everywhere. It's hard. But I'm actually confident. I think next year, if we had this exact conversation, we would be able to show, again, huge changes. And both urban and rural, there's so much going on. It's really hard to articulate. But
yeah, we need to actually gather the working class women, and we need to educate them that it is not going to have any adverse effect on their figures or whatever they're considered about. Yeah,
this is very important that at least every educated, for example, lady, she should know that breastfeeding at one end will prevent her from so many adverse effects of diseases and even yesterday, some religious scholar told me that even the Payghambar Hazrat Muhammad Sallallahu Alaihi Wasallam has said that feeding the child will not figure out your badly, but it will affect you very beautifully. It will bring a sort of charm on your face, and it will make you more active as a mother for work and for other things. So these are some teachings of Islam as well, and good practices, international practices, that feeding a child is not a thing which will affect your body badly. Rather, it will affect it for the good.
So my last question to you both is, what are the important messages that the general population should know about breastfeeding?
I'm going to say that breast milk is best. There is no question about that, and we would like that message to get out, that the mother's milk, and you did mention that it's free. It's clean, it's free, and readily available. So that message that I think we would like to.
My message would be that if anybody want to have love from their children, so she should breastfeed her child. Number one. Number two, if anybody want to make this nation or this community healthy and wealthy, she should breastfeed her child.
Okay, thank you so much, Ms. Melanie and Dr. Basir, for your time, and I'm sure this was really informative even for us. So yeah, I'm sure when it goes out, people are going to learn a lot about it, and I'm sure you guys are already doing a lot to aware people. Thank you so much. After hearing all of this, if you want to reduce the rate of stunting in Pakistan and want to give a healthy life to your child, please breastfeed, because that's a message that the Ministry of Health and UNICEF want to promote. Thank you so much.